Hi, my name is Ashley. Today we are going to take a look at some basic yoga poses that you can do for lower back strengthening and rehabilitation. Okay, so we'll start with a bolster under the knees to help relieve any tension in the lower back when lying flat. How's that feel?
Feels good.
Feels good. Can't have you feeling good for too long.
That's true.
All right. So, Dorian, if you would please bend your knees, feet flat on the floor, and bring hands to pelvis in shape of heart. So fingertips at pubic bone. And we'll start with pelvic tilt. It's really one of the most important actions that one can do to help alleviate any atrophy in the lower back muscles. So we'll start by pressing the small of your back into the floor. So navel in towards spine, and pubic bone will actually lift towards the sky. Take a few breaths. Now hips will stay down on the ground. We have a tendency to want to lift the hips up when we do this. So I'll ask you to keep the hips flat. And we're just tilting the pelvis. And then pubic bone down, the lower back will lift. And don't get discouraged if this is difficult at first, because if any of the lower back muscles, especially the multifidus muscles, aren't able to engage, this action might actually be difficult. Another approach is to take one hand, let's try this one, and bring it under the small of your lower back, and one to the lower belly or pubic bone. So as the pubic bone rises and the lower back presses into the hand and then into the mat, the lower belly scoops out. Exhale, navel in towards spine. And as you inhale, pubic bone lowers and the lumbar spine lifts. And alternate, scooping out the belly, curling the tailbone under. And then pubic bone down, lower belly lifts. And as you get the hang of this and start to relax, you'll notice how it also affects the head. So if you'd like, just relax and let the movement travel up the spine. Inhale, pubic bone down, belly fills up, and then exhale, lower belly scoops in, hips stay down on the ground. That's the tricky part. That is the tricky part. And we're just isolating this movement into the tilt of the pelvis. So if we have suffered from car accidents or any slipped discs or lower back injuries, again, this movement, as simple as it may seem, can be very challenging. So take your time and be patient. So there's level 1. And we'll bring the hands beside the hips, palms face down. Now I will place a block between Dorn's knees here for bridge, and ask you to hold that. And bring the heels in a little closer. So you want the ankles to be under the knees so we can stack our bones. And adding on to this pelvic tilt now, as you inhale, lift the hips, press down into your feet, lift the hips up, and exhale, lower. Walk the shoulder blades in a little closer together. Alright, so press down through the feet first. Inhale, lift the hips up. And exhale, lower. We'll take a few passes to help warm up the spine. Start the pelvic tilt first. So press the small of your back into the floor. Good, hold that. Now press into your feet, lift the hips high. Good, and lower. One more and sustain. So inhale, lift the hips. Hold it. Press your wrists and forearms down into the ground. And we'll take 3 breaths here. A restorative way to practice bridge is to slide a block under the lower back or the sacrum. So
medium setting, high setting, low setting.
Good question. So for now, we'll start in the medium.
Okay.
But you can go either low, medium, beforehand. And a restorative bridge using the block helps to create some traction in the lumbar spine. So I encourage you to take a few deep belly breaths. And don't just stop with the belly. Fill the belly, then the chest. Exhaling slowly. Good.